Did you know that a deficiency in vitamin B12 could be silently wreaking havoc on your body right now? Many people don't realize how crucial this vitamin is until they start experiencing symptoms like fatigue, memory issues, or even more serious neurological problems. In this video, we'll dive deep into what vitamin B12 does for your body, the alarming signs of deficiency, and how you can ensure you're getting enough of it through natural sources or supplementation. If you've ever felt unexplained tiredness or wondered why your body isn't functioning as it should, you'll want to stick around and learn how this essential nutrient could be the missing piece. Vitamin B12 plays a vital role in maintaining your nerve cells, producing red blood cells, and even supporting DNA synthesis. Without it, your body can't perform these critical functions efficiently, leading to a wide range of health issues. But here's the catch. Your body doesn't produce vitamin B12 on its own. That means you need to get it from your diet or supplements. In this video, we'll show you exactly where to find vitamin B12 in nature, including animal products like meat, fish, and dairy, as well as fortified foods for those following plant-based diets. We'll also discuss whether supplementation might be necessary for you, especially if you're at risk of deficiency due to age, diet, or certain medical conditions. By the end of this video, you'll have a clear understanding of the symptoms to watch out for, how to prevent a deficiency, and the best ways to ensure your body is getting the vitamin B12 it needs. Whether through natural sources or supplements, we'll guide you on the path to better health and energy. So, if you're ready to take control of your well-being and avoid the serious consequences of vitamin B12 deficiency, keep watching. You won't want to miss this essential information that could transform how you feel every day. Vitamin B12 is often an overlooked nutrient, yet it plays a crucial role in our overall health. This essential vitamin is responsible for maintaining nerve function, producing DNA, and aiding in the formation of red blood cells. Without adequate levels of B12, your body can't function optimally, leading to a range of health issues. One of the most common problems associated with vitamin B12 deficiency is anemia, which can leave you feeling fatigued, weak, and mentally foggy. But the symptoms don't stop there. Long-term deficiency can even lead to more serious neurological issues, including memory problems and mood disturbances. Unfortunately, many people don't realize they are deficient until the symptoms become severe. A common mistake people make is assuming they are getting enough B12 from their diet. While this may be true for some, the reality is that vitamin B12 is predominantly found in animal products such as meat, fish, eggs, and dairy. This makes vegetarians, vegans, and even older adults who may have trouble absorbing the vitamin particularly vulnerable to deficiency. In fact, as we age, our stomachs produce less acid, which is necessary for B12 absorption. Even if you're consuming foods rich in B12, your body might not be absorbing it efficiently. This is why it's vital to understand both where to find B12 naturally and when supplementation might be necessary. For those who follow plant-based diets or are at risk for poor absorption, B12 supplementation can be a lifesaver. Supplements come in various forms, including pills, sublingual tablets, and even injections for those with severe deficiencies. However, not all supplements are created equal, and it's important to choose one that suits your individual needs. Many people make the mistake of opting for low-quality supplements or neglecting to check the dosage, which can result in continued deficiency despite supplementation efforts. Consulting a healthcare provider to determine the right form and dosage of B12 is key to ensuring you're meeting your body's needs. In today's fast-paced world, it's easy to overlook the importance of proper nutrition, but being proactive about your vitamin B12 intake can prevent a host of health problems down the line. Whether through diet or supplementation, ensuring you have sufficient B12 is a simple yet powerful step toward maintaining long-term health and vitality. If you found this video helpful, make sure to subscribe so you don't miss out on more valuable content like this. We'd love to hear your thoughts in the comments. Your feedback helps us improve and create even more relevant videos. Stay tuned for more, and keep engaging with the community. Vitamin B12, also known as cobalamin, is an essential nutrient that plays a crucial role in maintaining the health of your nervous system and in the production of red blood cells. It is a water-soluble vitamin, meaning it dissolves in water and is carried through the bloodstream. Vitamin B12 is necessary for the proper functioning of the brain and for DNA synthesis, which is crucial for cell division and growth. A deficiency in B12 can lead to a variety of health problems, including anemia, fatigue, and neurological issues. This vitamin is unique because it is primarily found in animal products, making it harder for vegetarians and vegans to obtain it naturally from their diets. However, it can also be found in fortified foods and supplements, which are often recommended for individuals who may not get enough from their regular diet. One of the most important functions of vitamin B12 is its role in red blood cell production. Without enough B12, red blood cells can become abnormally large and unable to transport oxygen efficiently, leading to a condition known as megaloblastic anemia. This can cause symptoms like fatigue, weakness, and shortness of breath. Additionally, vitamin B12 is essential for maintaining the myelin sheath, a protective layer around your nerves. A lack of B12 can damage this sheath, leading to neurological symptoms such as numbness, tingling, memory problems, and even mood changes. In more severe cases, long-term B12 deficiency can lead to irreversible nerve damage. For individuals experiencing a deficiency, the symptoms can vary depending on the severity and duration of the deficiency. Common signs include fatigue, weakness, constipation, loss of appetite, and weight loss. Neurological symptoms may include numbness and tingling in the hands and feet, difficulty walking, memory problems, and mood disturbances like depression or irritability. In more severe cases, a deficiency can also lead to cognitive impairment and dementia. It's important to note that B12 deficiency can sometimes be masked by high levels of folate, another B vitamin, which can correct the anemia but not the neurological damage. This is why it's crucial to ensure adequate intake of both vitamins. When it comes to natural sources of vitamin B12, animal products are the richest sources. Foods like meat, fish, poultry, eggs, and dairy products are all excellent sources of B12. For those who follow a vegetarian or vegan diet, fortified foods such as plant-based milks, breakfast cereals, and nutritional yeast can be good alternatives. However, it's often recommended that vegetarians and vegans take a B12 supplement to ensure they are meeting their daily requirements, as plant-based sources alone may not provide enough of the vitamin. It's also worth noting that as people age, their ability to absorb vitamin B12 decreases, so older adults may also benefit from supplementation. Supplementation is often recommended for individuals who are at risk of deficiency, including vegans, vegetarians, older adults, and people with certain medical conditions that affect nutrient absorption, such as pernicious anemia or gastrointestinal disorders like Crohn's disease and celiac disease. Vitamin B12 supplements come in various forms, including tablets, capsules, and injections. Injections are typically prescribed for individuals who have difficulty absorbing B12 through their digestive system, while oral supplements are sufficient for most people. The recommended daily intake for vitamin B12 varies depending on age, but for most adults, it's around 2. However, individuals with certain medical conditions or dietary restrictions may require higher doses. One common hurdle in maintaining adequate B12 levels is poor absorption. As mentioned earlier, older adults and individuals with certain gastrointestinal conditions may have difficulty absorbing B12 from food. This is because vitamin B12 needs to bind with a protein called intrinsic factor in the stomach to be absorbed properly. In some cases, the body doesn't produce enough intrinsic factor, leading to a condition called pernicious anemia. For these individuals, B12 injections or high-dose oral supplements may be necessary to bypass the digestive system and ensure adequate levels of the vitamin. Another challenge is ensuring that people who follow plant-based diets are getting enough B12. Since B12 is primarily found in animal products, vegans and vegetarians are at a higher risk of deficiency. One solution is to incorporate fortified foods into their diet, but even then, it may be difficult to meet daily requirements without supplementation. Regular blood tests can help monitor B12 levels and ensure that any deficiency is caught early before it leads to more serious health issues. Vitamin B12, also known as cobalamin, plays a crucial role in various bodily functions, including red blood cell formation, DNA synthesis, and neurological function. Deficiency in this essential vitamin can lead to serious health problems, such as anemia, fatigue, nerve damage, and cognitive issues. According to the National Institutes of Health (NIH), approximately 1 B12 deficiency with higher rates among older adults, vegetarians, and those with gastrointestinal disorders like Crohn's disease. Symptoms of B12 deficiency can be subtle at first but may worsen over time. Common signs include weakness, fatigue, memory loss, and difficulty walking. In severe cases, it can lead to irreversible nerve damage. Dr. Ralph Green, a hematologist at UC Davis, notes that early detection is key, as prolonged deficiency can lead to permanent neurological damage. Addressing this requires a combination of diet, lifestyle changes, and, in some cases, supplementation. Vitamin B12 is primarily found in animal-based foods such as meat, fish, eggs, and dairy products. For vegetarians and vegans, fortified foods like plant-based milk or cereals are essential alternatives. According to a study published in the American Journal of Clinical Nutrition, 92% of vegans not using fortified foods or supplements are at risk of B12 deficiency. Therefore, individuals following plant-based diets are encouraged to either consume fortified foods or take B12 supplements. Supplementation is a common strategy to combat deficiency, especially for those at risk. Oral supplements, injections, or sublingual tablets are available, with injections being particularly effective for individuals with absorption issues. A case study published in The Lancet demonstrated that a 45-year-old patient with pernicious anemia, a condition that affects B12 absorption, showed significant improvement in energy levels and neurological symptoms after starting B12 injections. This underscores the importance of tailored interventions based on individual needs. One common challenge in addressing B12 deficiency is the delayed onset of symptoms, as the body can store the vitamin for several years. This often leads to misdiagnosis or delayed treatment. To overcome this, regular blood tests, especially for high-risk groups, are recommended. Catherine Tucker, a nutrition expert, advises that routine screening for B12 levels should be considered for older adults and individuals with dietary restrictions to prevent long-term complications. For those opting for natural sources, incorporating more B12-rich foods into daily meals is a practical step. For example, adding fortified nutritional yeast to vegan dishes or increasing the intake of fish and dairy products can help maintain adequate B12 levels. However, even with dietary adjustments, supplementation may still be necessary for some individuals, particularly those with absorption issues. In conclusion, addressing B12 deficiency requires a multifaceted approach that includes awareness, dietary modifications, and, when necessary, supplementation. By understanding the symptoms and taking proactive measures, individuals can prevent the long-term health consequences associated with B12 deficiency. Real-world examples, such as the case of the patient with pernicious anemia, highlight the effectiveness of targeted interventions. Regular monitoring and personalized strategies can help mitigate the risks and ensure optimal health outcomes. Vitamin B12 is essential for the proper functioning of the brain, nerves, and production of red blood cells. It plays a vital role in DNA synthesis, ensuring that the body's cells can replicate and function properly. A deficiency in this vitamin can lead to various health issues, including fatigue, weakness, memory problems, and even neurological complications. In more severe cases, the lack of B12 can cause anemia, which reduces the oxygen-carrying capacity of the blood, leading to further fatigue and shortness of breath. One of the main symptoms of a vitamin B12 deficiency is a feeling of constant tiredness, even after a full night's sleep. You may also experience numbness or tingling in the hands and feet, difficulty walking, and mood changes such as depression or irritability. It's important to recognize these signs early, as prolonged deficiency can lead to irreversible damage to the nervous system. B12 is naturally found in animal products like meat, fish, eggs, and dairy, making it harder for vegetarians and vegans to get enough of this vital nutrient. If you're not consuming enough B12 through your diet, supplementation might be necessary. There are a variety of supplements available, including tablets, injections, and even sublingual forms that dissolve under the tongue for faster absorption. It's always best to consult with a healthcare provider before starting any supplementation to determine the right dosage for your needs. Ensuring adequate intake of vitamin B12 can help maintain energy levels, support cognitive function, and prevent long-term health issues. To learn more about how to maintain a healthy lifestyle and ensure you're meeting your nutritional needs, make sure to subscribe to our channel. Don't forget to leave a comment below if you have any questions or want to share your experiences with vitamin B12. Stay informed and take control of your health by staying connected with our content.